All right, everyone. Hope you're doing well. Once again, I want to refer you back to Chapter 1 in the Generalized Planning Model. And if you remember those steps, understanding and engaging the priority population, assessing the needs, setting goals and objectives, developing your interventions, implementing the interventions, and finally, evaluating the results. And so it seems like a long time ago, but here we are. Chapters 13 and 14 deal with evaluation. The first chapter, chapter 13, is kind of an overview of the evaluation process, and then in chapter 14 we'll get down into the nitty-gritty of evaluation. So here's the learning objectives for this lesson, explaining the two basic purposes of evaluation, distinguishing between formative and summative evaluation, comparing and contrasting the various types of evaluation, and you'll see that that's process, impact, and outcome evaluation. Describe the process of conducting an evaluation and identifying some of the problems that may keep you from doing evaluation well. Listing reasons why evaluation should be included in all programs and explaining the difference between internal and external evaluations, and then describe a number of considerations in planning and conducting an evaluation. And here's some terminology to be on the lookout for. I'll just let you take a look at that rather than read that for you. And so here we go. Okay, so general definition of evaluation: it's the process of determining the value or worth of a health promotion program based on predetermined criteria or standards of acceptability. And I've seen another definition that says basically you are comparing what you've done to certain criteria or standards. Okay, so here are the two basic purposes of evaluation. I've got a little diagram over here on the right that sort of simplifies the evaluation process. So it starts up there in the left-hand corner with assessing, so getting your baseline data, and then you plan, do, and then finally evaluate, and then the feedback goes back into planning or replanning. But basically the two purposes of evaluation are to assess and improve the quality of the program or the delivery of the program, and then two, determining the effectiveness. And so in evaluation terminology, quality refers to formative evaluation processes and effectiveness to summative evaluation. So as we'll see here in a bit, formative are things that you do throughout the process, and summative, as it implies, are things that you do at the end to determine whether or not your programs have been effective. Okay, so here we go with formative evaluation, and those are the measurements or judgments made before or during the program to control, assure, or improve the quality of performance or delivery of the program. All right, so we're constantly looking at our methods and procedures and determining whether or not things are going as we plan for them to go, and if necessary, making adjustments on the fly. And then summative are those things that permit conclusions to be drawn about our outcomes and impact, or the benefits of the program, and those typically take place at the end of a program. All right, and so if you remember back to the precede-proceed model, that fairly involved program that had 9 steps to it, and there were steps that took place before actual program implementation. That was the precede portion, and then there were things that happened after the program was implemented, and that was the proceed part of the model. And then the last 3 steps of that, steps 7, 8, and 9, all had to do with evaluation. And so it was process evaluation, impact evaluation, and outcome evaluation. Okay, so process evaluation are any things that we do during the implementation of the program to control, assure, or improve the quality of performance or delivery. And some typical process evaluation questions are, how satisfied are the participants with the program? Is there anything we should change about the way the program is offered? What did people think about the materials, the curriculum materials that we used? If we change the time of the program, would more people come, or the day it was offered? How effective were our instructors or our speakers? if we had transportation, did the bus drivers adhere to the pickup and drop-off schedule, or where there's some problems there. So all of those things are all about the process of delivering the program. Very important, but we want to be always on the lookout for those things. An impact evaluation focuses on those immediate observable effects of a program, changes in attitude, awareness, knowledge, skills, behaviors. And so it is one way of assessing program effectiveness. And so some evaluation questions or impact evaluation questions: how many people stopped smoking if we were doing a smoking cessation program? If we were doing a cardiovascular risk reduction program, how many people actually reduced their risk of cardiovascular disease? How many participants continued to exercise regularly 12 months after the program ended? Would be an impact question, so you're seeing behavior change there. Of those participants that are sexually active, what percentage are now utilizing safe sex practices? Again, that's impact in terms of behavior. A policy change: how many schools have replaced snack and soda machines with more nutritious options? And then how many women, another behavior issue, report doing regular breast self-examination 6 months after the program concluded. So that's your program impact, okay? All right, so outcome looks further down the road. It's the changes in the incidence of the disease that you're looking at, whether it's obesity, cardiovascular disease, diabetes, or any other things. So we're looking at that long-term change in epidemiological disease rates. Generally, we measure that by looking at morbidity and mortality statistics in the population. And our program might last 6 months, it might last a year, it might last 3 years, but realistically, changes in the incidence rate, unless you're looking at a very confined area, in a community, let's say Harrisburg, for example, if you're looking more globally at the county or you're looking at the state level, it may be a long time before you see the outcome factors actually change. So here's your outcome evaluation questions. Was there a reduction in the number of cases of STDs reported in Hancock County, if that was the area you're working in? Was there a reduction in the incidence of type 2 diabetes in the priority population? Was there a reduction in the incidence of stroke in Crawford County? Or has there been a reduction in the percentage of overweight or obese children in Georgia? Those are all big picture outcome questions that typically won't be answered, during the lifespan of the health promotion program that you're doing, but we may see that years, 2 years, 5 years, 10 years down the line, maybe even longer. All right, so here's some purposes of evaluation to determine whether or not our objectives have been achieved related to improved health status. To improve our program implementation, and again, I hope you realize that that's the process piece of this. To improve accountability to funders, the community, and other stakeholders. So we're doing evaluation so that we can demonstrate the effectiveness of our methods, and then we can communicate that to the folks that have given us funding to do this. We can report that to the community or any other people that have a vested interest in it. We want to increase support always for our initiatives, so that's another purpose of evaluation. Number 5, contribute to the scientific base for what we know about public health interventions. So, if we do something that's effective and we can demonstrate that it's effective, then we can use that to help inform, the public health community that, hey, this works. And finally, not finally, but at the end of this slide is to inform policy decisions. So an example of this is, I'm trying to show with our physical activity in the schools initiative that if we get more physical activity in the schools, it's going to increase student learning, it's going to reduce behavior problems, it's going to reduce absenteeism. And so if I can demonstrate that, then I can go to the school board and say, hey, here's what's happened over the last 2 or 3 years. now how about considering putting in a policy where so that all of our students get 60 minutes of physical activity per day? And so, gathering that data through the evaluation process helps then to go and advocate for policy change. All right, so here's the general framework for program evaluation. The steps starting up there at the top. First step would be to engage your stakeholders. So get them involved early on in the process so that they can help you understand the needs and the wants and the basically the everything about the priority population, because that's important in helping you shape your evaluation methods. Then proceeding along, following the arrows, you have describing your program. What are the interventions? What is it that you're going to do? And then you focus your evaluation design. Notice how that early in the process that starts. So before you've implemented, obviously, you need to have your evaluation methods and tools and so on in place. And then you gather evidence. That's gathering the data. This is just like research. And so you may have had a research class, you may be taking a research class, you understand that in research, you have your research design, you have your methods for data collection, you collect the data, you analyze the data, you draw conclusions about the research, and then you share that. So same thing with program evaluation. So we gather our evidence or we gather our data, we analyze that, we make our conclusions, justify the conclusions, and then we share that information and our lessons learned. In the center of this model, you've got some standards for program evaluation. Utility means, are the methods useful? Feasibility, is this something that we can do? Do we have the skills? Do we have the knowledge, the time, the resources to be able to do that? Propriety, who owns the information? And then accuracy, of course, is paramount in evaluation, just like it is in research. If we're not accurate, we're going to get bad data, garbage in, garbage out. So, everything we do needs to be of good quality and with those principles in mind. All right, so here's some problems with evaluation. Either doing evaluation planning too late, failing to build it into the program planning. That's a real problem. You've got to be thinking about evaluation as you're trying to conceive the interventions that you're going to use to tackle the problem. You don't have the resources to do it properly, and that means you may not have the personnel, or the personnel aren't qualified, you don't have the time to do it, or you don't have the money to be able to do it. There may be organizational restrictions on hiring evaluation consultants and contractors. If that's the case, then you have to do what's called an internal evaluation, and as we'll see a little bit later on, there are some problems associated with that. Many funding agencies now are requiring that you build in external evaluation into the plan, into the budget. So you do have to dedicate a certain amount of resources to hire people from the outside to come in and evaluate your programs. And that can eliminate some problems that we'll look at. Some of the other problems with evaluation are that the changes that you're looking for may occur too slowly, they may be too small, or they may not last. And so, if we're looking at obesity, for example, obesity for the last 20 years has been on a steady rise. We would love to see that start to go downward, but before it goes down, it's got to level off. And so, one of the changes that you might be looking for is, a zero increase in the percentage of kids with obesity. And so that's kind of hard to detect. So, you're really looking at small changes that may indicate that, there'd be bigger changes down the road. It also takes a long time. So again, if you've got a 3-year program or a 5-year program, you may not, see the changes happening in the entire population within that period of time. This is related to that, but the length of time allotted for the program is not realistic given the desired changes. So if we want to see big changes in disease rates, incidence rates, we're probably looking at decades for that to happen, and we may not have funding for that period of time. And then restrictions that may limit the collection of data with the priority population, and those can have to do with policies, with ethical issues, and with trust or a lack of trust between the program evaluators and the priority population. We hope that doesn't happen, but certainly can be a limiting factor. All right, another slide of problems here. Difficulty in determining cause and effect. The environment that we work in health promotion is a complex environment. It's not a laboratory where we can control the independent variables to look at the effects on the dependent variable. We've got a very complicated and complex situation, and there's just no way to control. And if you can't control a lot of factors, then it's very difficult to point to the fact that this effect was caused by these programs that we deliver. If you're doing multiple interventions, as we hope to do with these complex problems, it can be difficult to separate the effects of the interventions if you're seeing changes in impact or outcome. I don't know that that's necessarily an awful thing, but if you're trying to determine which interventions are most effective, it can be difficult to do, given the complex nature of the things that we're looking at. Discrepancies can arise between professional standards of evaluation and then what you're capable of doing as an evaluator. Maybe you don't have the necessary training, maybe you don't have a lot of experience. We know it should be done this way, but yet this is all we can do given our limitations. We all want our programs to be successful. We all want them to demonstrate success. The very nature that we want things to be successful can introduce bias into the whole process, into the data collection, into the data analysis. Same thing with research. We always have to be on the lookout for this. We always have to guard against bias influencing the results. Stakeholders' perceptions of the value of the evaluation can vary, so we need to be aware of that. And then finally, intervention strategies, as we intend them, are sometimes not delivered as we intended them to be. And that could be because of the instructors that we select, or maybe because of circumstances, or whatever, but could also be that we don't tailor our intervention strategies to the priority population, so we don't make them culturally sensitive or culturally specific. All right, and so here's a little model here of an evaluation timeline. And so evaluation starts before a program actually starts. So there's a pre-program element to it where we gather information from the priority population that we use as baseline. So the baseline information is then the comparison point for what we get once after the program. So we compare what we get afterwards to the pre-program baseline to determine change. Early program, this is primarily process evaluation. So we're asking ourselves, how's the program going? Go back to some of those process evaluation questions. Are the participants satisfied? Is the time that the program's offered good, or do we need to make some changes, and so on. So we're just trying to determine how things are going and make some changes on the fly if we need to. Late program, we're actually taking a look at our goals and objectives. So were the goals and objectives of the program met? And then didn't have enough room to continue this on out to the right, so I put it down here at the bottom, but this is a linear thing. Post-program is after the program has ended, have there been any long-term or lasting changes? If if you think about a class that you take in college, you might demonstrate during the course of the course, that you have a high degree of knowledge. You do well on the tests, you do well on the papers, you get a good grade. But have you really learned? The real test of learning is if we, assessed you 6 months later or a year later, how much of that information could you still recall and apply? So that's what, real change, the measure of that is, are the changes lasting? Do they persist over a period of time? Okay, so planning for evaluation, pre-program, we get the baseline data that reflects the initial status and interest of the participants. During the program, we look at things related to process evaluation, staff, sites and facilities, quality of media and things that we're using, participant satisfaction. And then late program, that's the impact evaluation. We're looking at have the goals and objectives been achieved? Was a group or an individual approach more effective? How many people stopped smoking? How many people lost weight? Did they keep it off? Again, that's the long-term, more long-term effect. How many people in the priority population increase knowledge, change their attitudes, or reduce their risks? All right, and so ethical considerations, again, this is the same thing with research, but evaluation or research, you could use those terms synonymously, should never cause mental, emotional, or physical harm to those in the priority population. So, that's protecting human subjects. And human subjects, it goes back a long time. It goes back to abuses that happened during the Second World War and Nazi concentration camps where horrible experiments were done on human beings, in the interest of, air quotes, science. And that continued on into the 1950s and 60s and 70s. You may have heard of the Tuskegee syphilis study, where African American men who had syphilis, they were, some individuals were treated with penicillin and others were not. And so, you had people die as a result of this disease because treatment was withheld even though they knew that treatment was effective. So that was a clear case of abuse of human subjects. And so based on those horrible cases, policies and procedures were put in place to protect human subjects from this kind of emotional, mental, physical harm. And so most organizations, whether it's a hospital, whether it's a university, have what are called institutional review boards. And whenever you're going to do evaluation, whenever you're going to do research, you have to get approval from these IRBs prior to proceeding with your evaluation or your research. And so you submit a proposal that talks about all of the things that you intend to do and all of the methods that you intend to do. Use in the evaluation or the research. Who are you collecting data from? Is it adults who have the ability to give consent, or is it from children where you're going to have consent of parents or guardians? Anytime you're working with kids, there's a more intense level of scrutiny that goes into the procedures. All of this is designed to guard against the abuse of human subjects and protect the well-being of the people that are going to be part of your evaluation or research. And then finally, we need to think about who's going to do the evaluation. There's internal evaluation, so the evaluation is done by members within the organization, or external evaluation where you're hiring somebody from the outside to come in and do the evaluation. And that can be a single person, a consultant, or it could be a review team that comes in and does the evaluation. But in either case, you're contracting with an external group to come in, or an external individual to come in and do your evaluation. And as you can imagine, as we said before, if it's done internally, there's that risk of bias, and maybe you don't have the resources or the expertise to do it, so the quality might not be there. If you're hiring from the outside, presumably the people that you're hiring have those qualifications. They do that for a living, and therefore they can come in and do it, and it would be, as bias-free as it possibly could be. Okay, so that's it for chapter 13. Hopefully that wasn't too bad. I will warn you that 14 is going to be quite a bit longer and a little bit more involved, but we'll get through it. So I hope you all have a good week, and we will see you in class.